All right, so welcome, baby nurses. Today we are going to learn how to prime an IV bag. Okay, so a lot of hospitals do have this plastic covering on there. It just makes sure that the bag is not necessarily tainted with. You'll be able to see the slit in the bag unless you know exactly where you should slit it down and use it to open in order to receive the actual fluid. Okay, so today we are actually using pump infusion set. You can use this whether you're using with a pump or whether you decide to free hang the fluids and the patient might be getting a bolus of the medication. You can tell that it's pump tubing as you see this blue stick kind of placing here. That's the part where you actually place into the pump. And you see the clamp at the bottom that allows the pump to cut the fluid on and off or run it at a control rate. You see the adapter that's actually going to connect to the pneumatic saline and then the adapter that actually goes into the patient. All right, baby nurses. So at this point, we're ready to spike our bag. We can go ahead and flip our bag over because we do not want to waste any of that fluid. Once we go ahead and spike it, we're going to leave it upside down because we are going to close off the clamp to avoid any type of air bubbles being placed inside of our tubing. What I want you to do is insert the tubing into the base of it. You see just a little bit of space left there. I want you to squeeze the top of the tubing just like that. You can get to a halfway point, 3/4. I just want to make sure you are able to see the fluid actually flowing in there. So as you can see here, you see it going at a rapid rate. You see it start to slow down. It's really based off the weight of gravity. You lift it up higher, it'll run a little bit faster. Lift it down lower, it'll go a little bit slower. So hopefully this was helpful for you. As you can see here, this is kind of how your bag will be set up. You actually want it higher than the IV line placement. As you can see, you are going to make sure you unclamp it when you want to allow it to flow and close it off when you don't want it going. As always, thank you for listening to Talk Teach Nurse. I want you to follow, like, and comment, and drop some topics down at the bottom that you want to see. Let me know what you guys want.